Hi guys, my name is Karen Dees. I am the Marketing Manager for Patient Concierge Services. For those of you who don't know who we are and what we do, we offer a full wraparound service before surgery, during surgery and after surgery, as well as arranging your appointments for you with your chosen plastic surgeon. And part of our service is getting to know the choice of plastic surgeons here in Bali. So today we have the honour of chatting with Dr Putri.
Hello.
Here at NgoerahSun Aesthetic Wellness and a Dental Centre. So could you tell us who you are and a little bit about yourself?
Okay, a bit about myself. I'm Dr Putri. I'm a board certified plastic surgeon from Indonesia that I currently based in Bali. So for my aesthetic practice, I do it here in NgoerahSun Wellness and Aesthetic Center. Yeah.
Beautiful.
Yes.
And how long have you been a plastic surgeon?
For now, I've been a plastic surgeon for 4 years.
Yeah?
Yes.
And what's your favourite procedure?
My favorite procedure for now is, I can say it's about facial rejuvenation.
Yes.
Like you can say like facelift and also like upper blepharoplasty, fat grafting to your face and brow lift and something like that. And also I'm passionate in body contouring surgery.
Body contouring.
Yes, like arm lifting, you know, like tummy tuck.
Is that called brachioplasty?
Yes. Medical term for arm lifting is brachioplasty.
Okay.
And like pipe lifting and also like vaginal rejuvenation. Yeah, like labioplasty, vaginoplasty. And
wow, that's so interesting. Because I've talked to many plastic surgeons in Bali and lots of different hospitals, and I am always curious, like, what is the menu? Like from head to toe. So you've kind of just touched upon it. So let's just recap for the viewers that are watching if they're curious about you. So it's a deep plane face and neck lift, and it's the option to have either deep plane or smash or mini.
Yes.
So I guess you will look at the person's face and then make a recommendation based on what their desires are. So upper and lower blepharoplasty, fat transfer.
Yes, fat transfer.
How about lip lifts?
Lip lift, if it's indication, I will do lip lift with this, like a horn incision.
Okay.
That's part of facial rejuvenation too.
Part of the facial.
And not a very complicated procedure actually.
Yeah, it's becoming more and more popular, I see.
Yes.
And then if we were to work our way down the body, breast?
Yes, breast surgery, but if you ask me about my favorite procedure is the face and also the body first. But I do some of breast surgery also.
Like breast implants?
Breast implant and also breast lifting. And because I'm a reconstructive surgeon also, I do reconstruction after the breast cancer.
Okay.
With implant or with flap. Yeah.
Oh, that's so interesting.
Yeah, that's a big surgery.
Of course.
But it's a very life-changing surgery for the patient. Yeah. Not only their functional, but also aesthetic results.
Yeah. It's going to be like, so as a woman, it's so interesting how important our body and our breasts are, of course, our face as well. But if somebody's gone through, the trauma of having like cancer and had their breasts removed, you can do like a reconstruction.
Yes.
Beautiful. Okay, so moving further down the stomach.
Okay.
Yeah. What can you do for the body?
For the stomach is tummy tuck. We can call it like mini tummy tuck if it's like below the umbilicus. For people that have excess skin below the umbilicus, we do the mini tummy tuck. If you want like a full tummy tuck, then you do a full tummy tuck like from hip to hip incision.
Yes.
But for some of the patient, especially the patient that just underwent like bariatric surgery or just have underwent a massive weight loss, sometimes we need the bigger procedures like a belt lipectomy. Is like a 360 degree of tummy tuck, but that's a very massive procedure. Okay. And also liposuction, of course. Yeah, liposuction in pretty much all of the area of the body. Okay, because that's really on the rise at the moment, isn't it? I've seen like the gastric sleeve, and there's the rise of like Ozempic, Wegovy, and most of our clients at Patient Concierge Services are a little bit older. And I think when you're post-menopause, it's so easy to carry unwanted weight. Yes. So this is like a solution for some ladies to undergo this weight loss options, but then they're left with loose skin. Yes. Because as you age, your skin elasticity is not as good as the younger people. So if the younger people lose their weight, lose their fat, their skin like shrink that good because the collagen, the elasticity is still good. But if you're like old and then you got like this massive weight loss, your fat is gone, but your skin is still there.
I know.
There's no other way to fix that. Otherwise, you have to do the surgery to cut the excess skin.
Yeah, and I really empathize with women and men who've gone through this as well, because you've had this amazing victory of like losing the weight, which is obviously great for your overall health and strain on your heart and your organs. But then from a practical perspective, you might be like chafing, you know, like with the skin, like maybe like irritation, especially if it's on the inside of the legs.
Yeah, this is a very good question because, you know, aesthetic surgery is not about only aesthetic.
Yes.
But some people, like, they have like this huge breast, or they have like this super massive excess skin. They have this cleavage that make them irritated, or sometimes they have eczema on that cleavage. So it's very...
It's a practical element.
Yes. Yeah. So it's very disturbing. So our role here as plastic surgeon is not only addressing the aesthetic part, but also erasing that kind of complaint so they can like live comfortably.
Yeah.
Right. It's not only, I want to be skinny, I want to look good, but no, it's just more than that actually.
I absolutely love that. Because so many people, I think it's a debatable topic. You know, there's a little bit of a stigma sometimes when you mention plastic surgery, but like you say, it's not necessarily about being vain or, you know, wanting to look like some of these people on Instagram, like influencers. It's actually like an inside job. Like if you're living a life that's not necessarily of good quality, and it will, if you improve your appearance, you will feel good inside, and then it reflects outside. It's an inside out job.
Yes, exactly.
Beautiful. At Patient Concierge Services, we don't directly recommend a surgeon for legal reasons, but what we will do is empower our customers and patients to make a choice independently. And we'll do that by giving as much information as possible on the experience, the availability, and the budget. So if somebody says to me, I'm happy to wait 2 years, we will maybe give them information about a surgeon that we know has a 2-year wait list. If somebody says, I want it done under 9,000 Australian dollars, that'll then filter down the process. So when I was learning more about you, Dr. Putri, one of the questions that was coming up a lot from our inquiries is they couldn't see much evidence online in terms of like Google reviews, or if they search for your name in Facebook groups like Facelift in Bali, founded by Pamela, which is an amazing community of maybe like 26,000 and a half people. You know, people will search for the name and then they'll come up with people who've had an experience with that plastic surgeon. But for you, there's not much evidence out there. But we've still managed to get quite a few people booked in with you this year.
It's very nice.
So for anybody who has any concerns around that, what would you say?
So about actually many patients ask me about the before and after pictures. Usually, if you join several of my teleconsultation, I'll prepare them like this presentation.
Like a presentation.
Sometimes if they want it, I will present about the detail of the surgery procedure. But our regulation here, and also my belief, I'm very honored and concerned about patients' confidentiality. And here we have the form actually about whether this patient want to be published. They can choose. They want to be published like only in like, let's say like the conference. They want to be published like on our Instagram. They want to be published in other way. They can choose or they don't want to be published at all. And most of our patients here come seeking for a private services. So I really respect their wish to be private. Because that's their body, that's their face. So I have to be respectful for that. And also regarding the law, of course. But usually on presentation, I'll give an example, like 1 or 2 patients that they're willing to be published. But if they're not, there's no compromise. I won't do that.
Of course. And I totally respect that. We have many patients at Patient Concierge Services that say, I want to be completely private. Like we'll do a presentation sometimes when we're talking about the choice of surgeons, and they'll say yes to that, but no to being on Facebook. And some of them just give it 100% no, you know, depending upon their job, or they're worried about other people's opinions.
Yes.
But then we do get some patients, like we have a wonderful lady booked in with you for a facelift.
Yes.
She's agreed to be fully public.
Oh, yeah, good.
So anyone that's interested in Dr. Putri, hopefully by the time this video is live, we will have a lot more evidence of women sharing their journey and sharing their results and their experience. And also, as well as, the price is so good. The price is so good. I think at the moment, it's April 2026. I think it's like 89 million Indonesian rupiah.
Yeah, I think it's around that.
Yeah, and the Australian dollar's so strong at the moment. I think that's maybe like $7,500.
Oh, yeah.
Something like that. So obviously the exchange rate changes every day, and the price might change next year. But yeah, it's a really good price. And what does that include?
Actually, our price here is a package price.
Okay.
For a general anesthesia procedure, it's already covered for the surgery itself.
Yes.
And all of the medication.
Okay.
And the aftercare.
Okay.
But it's not included the pre-operative lab examination.
The tests are extra.
Yeah. And the consultation price. But
okay.
To be simple, is once you decide to do your surgery here, then everything is covered until the aftercare and until the suture removal at least.
Yeah. So that would include one night stay in a beautiful room, which we'll include in this video. Of the
I think it's 2 nights.
Is it? Yeah. Okay. 1 or 2 nights, depending on their recovery, I guess. Yeah.
A maximum 2 nights.
And they have 2 follow-up appointments or 3 follow-up appointments?
3. But usually we will follow up until the suture removal. If it's like more than that, then it's more flexible. And
when do you like to take the stitches out? Is it different?
Very different. The first, the regio of the body, and the second, of course, the patient factor. For the regio of the body, usually for the face, it's usually 5 until 7, but sometimes it can be up until 10. It really depends on what kind of procedure that we did, and also the patient if it's like not dry enough, of course we don't take it out.
Okay.
We feel like, the wound is not gained its strength enough. We sometimes postpone it, because every patient is different. We cannot leave it too long.
Yes.
Because it will make a suture mark.
If it's left too long. Yeah. Because I've noticed like I say, we work with many different plastic surgeons, as some of them always remove them 8 days after surgery. And then some of them say between day 12 to day 14. I'm saying for facelift.
Yeah.
But for the more delicate areas like upper or lower blepharoplasty, lip lift, like between day 5 and day 7.
Yes, exactly.
It's so interesting that like different parts of the body heal at different paces.
Yes, because for the face especially, we have so many vascularity there. So many vessels. So many vessels mean so many nutrition.
Oh, okay.
That's why the wound heal faster than the other part of the body. That's why for the arm, for the thigh, and for the tummy, it's usually take up until like 2 weeks.
Okay.
Because it heals slower than our face. Yeah. But still, because we are plastic surgeon, we have to assess based on the patient, not only like strictly.
It's not like a one rule applies. Okay. Yeah, because I've noticed with nearly all the plastic surgeons that we work with is that when they do body surgery, like breast and tummy tuck, everything stays closed in terms of the bandages, so there's no wound cleaning to be done every day unless they have a follow-up appointment. And is it mostly dissolvable stitches on the body?
Actually,
or a bit of both?
It really depends on the surgeon preference. Some of them use dissolved suture inside, and the outside like a steri strip. Yeah, but the other surgeon, I know that they use like unabsorbable suture. So it really depends. But for me, it depends on the case. If it's like only a simple lifting, not a lot of tension, maybe I don't use the non-absorbable one. But if it's like a tension and you do a lot of work, and just to make it like safe,
more secure, you do like a combination of both. Okay, beautiful. At Patient Concierge Services, we have a real range of women and men that come to us asking for cosmetic surgery. And still, the facelift is the most popular. And I think usually over the age of 50, but we do get some women coming to us late 30s, mid 40s. But I would say mostly around over the age of 50 up to 60, and all of them have different textures of skin, and I think it depends on their lifestyle, whether they've had extreme sun exposure, or whether they've been smoking cigarettes, or like maybe they've been a bit party animal with alcohol. But I personally have noticed that usually the right time to do it is maybe like early 50s, when there's still enough collagen for the recovery, and it's like there's not too much extreme sagging.
Yeah.
But from your perspective, like, would there be like an ideal candidate that you would explain?
I'm talking about anatomically. Actually, when we talk about face rejuvenation and facelift, we can divide it into 3 parts.
Okay.
So it's like an upper and mid face and lower face. The upper is, we talk about the brow lift, the forehead reduction, and the mid face is this one, our cheek, and also the jaw and nasolabial fold, and for the lower is for the neck.
Okay.
So for the ideal candidate, if we look at the patient presentation and also anatomical changes, for the brow, usually the brow drooping. It's the brow drooping. We have a ptosis brow. It's an indication for a brow lift.
And does that mean that the skin and the brow is dropped below the brow bone?
Yes, usually if we have here, if you touch it, there is a bone that is a cage for our eyes.
A cage.
Yeah, it's below that. But yeah, there's a further examination for that.
Okay.
That's only plastic surgeon. It's secret now. So it's like drooping. And then for the mid face, usually when we see there's a deepening in the nasolabial fold.
Yeah, these bits.
Yeah, it's like, and also the jaw. The jaw is the most prominent one that we can see if the skin is already sagging or not, or there is a gland here already sagging or not.
Okay.
And also the neck, if we already have like this neck band here.
Starting to come here.
It's our indication to do facelift. But if you still have like a good jawline here, because the misperception is facelift not addressing skin quality.
Yes.
Yeah, for like a fine line, facelift don't fix that. Maybe 6 days, 7 days, it looks amazing. The before picture is so many wrinkles, but 6 days it's missing. You know what? Why? Because of the swelling.
Yeah.
The swelling acts like a filler and makes that line disappear. But after that, 2 weeks and after the swelling is gone, they will go back. Yeah. Yeah. So actually the facelift is addressing this one, like the saggy, and also this one.
Okay.
When we pull it. But for the wrinkles, no.
Okay.
Yeah. So we have to search for another adjuvant treatment for the wrinkles.
Okay.
But it's going to be good at the first week. Yeah. I can tell you.
Yeah.
So if you see a facelift result on the first week, don't make it like a final yet. We have to follow up for a long term to see the final result.
I love that explanation. I don't think I've ever heard it explained so well. So my interpretation of how I understand what you've just said, if you'll allow me to repeat, is it doesn't really matter about the age. It depends on how the face is reacting, the presentation, and it's in 3 stages. So as the brow dropped below the brow bone,
rim,
you called it the eye cage.
Yeah, the orbital rim.
And then, so from here to here, if this is starting to drop lower, and then the lines here around the mouth are a lot deeper, and then we start to see more sagging on the jaw and around here, and then a little bit on the neck. If those 3 areas are all starting to drop, then they would qualify for a facelift.
Yes. Well, we don't really look at the age actually. But commonly it's about 40 usually it start to age. But actually 30 is already, we call it aging phase.
Aging phase.
Aging phase means like developing, it's already developing, but age phase is usually above 50, right? It's already age. But for above 30, we usually call it aging because it's on the process.
They're just starting to show the signs of aging.
Yes.
Because so is it true that once you get over 50, the whole skeleton starts to change?
Yes. It's atrophy for the fat and also the skeleton. Everything's changed. So
it's so mean. It's just like it's so hard being a woman sometimes, and menopause and
hormonal things.
And then it's just like, and then your face starts to go to the floor. It's like, damn you, gravity. It would be really good to talk a little bit more about the stages of the recovery to manage people's expectations, because from week 1 to week 12, their appearance is going to be really different, isn't it?
Yes.
So could you explain like how people could manage their expectations in their mind when they look in the mirror after day 1?
It's about facelift, right?
Yes. Facelift because it's the most popular one.
Okay. I think for wound face healing itself, the first 3 days is inflammation. So the swelling is at its peak on the first 3 days. And for the face, the swelling is more prominent in the other part of the area. Back again with we have like more vascularity on the face, so the swelling is also more severe. And compared to the other part of the body. And then usually after 1 month, it's gradually decreased.
Reducing down.
Bruising also, usually after 1 month, it's gradually decreased. So I think for the patient, the hardest period is the first 3 months.
Okay.
Yeah, because the scar is also at its worst at the first 3 months.
Yeah.
And then after 3 months, it starts getting soft and
less visible.
And if we talk about the wound healing, the final is 1 year.
Okay.
And it's done. But actually, every process is still happen until 1 year.
Yeah.
Yeah, and also if we talk about facelift, many people concerned about the numbness. Right?
Oh, yeah.
Yeah. Numbness is unavoidable.
Yeah.
It's something that will happen. And usually it takes up to 6 until 1 year to get back.
Okay. To repair itself.
Yeah. But it's again a very different. We cannot like say like every people like will heal at the 6 months. We cannot, but the time range is usually 6 until 1 year. And I understand sometimes very uncomfortable for the patient. So in our center, we usually make this clue card with the timeline.
Oh, that's good.
Yeah, so they can expect. It helps us, oh, this is normal to happen, something like that.
I think it's really important because there is a lot of mental gymnastics that happen where you're like, is this normal? My smile is wonky.
And they start to look at the online, they not experience this. Why I experienced this one? So because it's very different.
Yeah.
But I understand. That's why we see the patient in outpatient setting. And that's when the doctor can say it's normal or not.
Okay.
Yeah.
So week 1, if you're loving your results, it's great that you're loving them. But you have to also remember that wrinkles will come back when the swelling goes down.
Usually,
And I've heard a lot of plastic surgeons say that most facelifts drop between 10 and 20% over the coming year once everything settles down. So although it won't be exactly how it was within the first 2 weeks, it'll still be a huge improvement. Yeah. Would you agree with that?
Actually, different on the case.
Case by case.
Case by case. There is a patient that come with not a very prominent aging sign. Of course, the result will be better than the one who has this very saggy gland, submandibular gland, also the very prominent sagging neck. Of course, it will be very different challenge for the surgeon to fix this patient compared to not a very prominent sign of aging patient. It's a different one. And also for the long-term result, it's very different, but I agree it has to be at least 1 year because we are fighting with aging face. The aging is still there. Even though we fix it, the aging is still going on.
Yeah,
something
it doesn't freeze time.
Yes, it doesn't freeze time. Agree, but actually the goal is to make it better than before.
The goal is to make it better than before, I have some women that come to me that say, I only want a neck lift. And obviously from talking to lots of plastic surgeons, they don't normally like to do that because they say if they just did the neck over the year, the neck might look great, but then the jowls are going to drop. So from your opinion, is it better to do the whole thing?
Depends on the patient again.
Okay.
If you have this kind of presentation, like a turkey neck is like the patient has no you see the
definition between the jaws.
Really no definition at all, but their mid-face is still good. There's a procedure that we call isolated neck lift.
Isolated neck lift. Okay.
Only neck lift. So we make an incision here and we fix the platysma muscle and also the gland over here, and we'll have more definition on the angle of the chin and also the neck.
Okay.
Yeah, there is a procedure. So it's really selective cases.
Really selective.
Yeah, very different. Because it's rarely people that only aging on the neck, right? But there is a cases.
But it can happen.
It can happen.
Yeah. Okay. Could you tell us a little bit more about your training as a plastic surgeon, where you did it? Have you had any additional overseas training? I think this is a question that we get asked quite frequently from our inquiries.
Yes. So I am a plastic surgeon Indonesian board certified. So I graduated in 2023.
Okay.
My training is here in Bali, Udayana University, for about like 5 years, I think. And after I graduated, I pursued my fellowship. The first one in Bangkok, in Ramatibadi Hospital under the Mahidol University. And also just recently I went to South Korea in Asan Medical Center for another fellowship in breast surgery. And also I'm getting exposed by so many aesthetic cases also in any clinics, and one of them is, the longest one is in Thai clinic, which is the Image medical clinic in Bangkok, Thailand.
What does that mean, that you got exposed by the medical?
Like I observe and do my training there.
Okay.
The most exposed aesthetic surgery, but like in the hospital in Korea and also in Bangkok, I pose in both reconstructive and aesthetic, but in this clinic and only aesthetic.
Only aesthetics, Maybe this is a controversial question, but how does Korea compare to Thailand?
So Thailand is more similar to us.
Okay.
Because they have this medical tourism. Like many Australian patients also come to Thailand, I think, and many Asian too. So they're like balanced between the Asian surgery and also the Caucasian surgery. As for Korea, I think, they have international visitors also, but mostly I think Asian. So because here I'm not only treating like Caucasian, but also our local people. So I learn both from Asian and also Caucasian.
And if somebody was watching and they can't decide between going to Thailand, KL, Bali, or even Singapore, or maybe they're even willing to fly to Korea or Istanbul, what would you say would be a great reason to choose you and here?
I think aside from the surgeon, of course, if we're talking about the surgeon technique and capability, we have to compare like person to person, right? We cannot compare like Balinese to Thailand. We cannot compare because they're different. Not all the plastic or the cosmetic surgeon, I'm not talking about the plastic surgeon, but cosmetic surgeon, the one that claim to be a cosmetic surgeon, not all of them having like a good result, but not all of them is bad also. In here in Bali, it's also like that. It's very depends. I cannot judge on that. But from Bali, I think our hospitality is the best. In the term of the package and also how we treat our patients, how we manage their
journey.
I think I can say that.
I believe you.
I think we are better. I think,
and I think as well, because this hospital is maybe like 1 or 2 years old, is it?
This one?
Yeah.
Our Ngoerah Hospital is already decades, I think. But this Hunter is 3 years.
3 years, and obviously I'm like, you should have your surgery here. They have chandeliers,
right?
And amazing plastic surgeons.
It's affecting our mind actually.
But it is like walking into a beautiful hotel, and they have VIP rooms, and even in the patient personal room, they have like these intercoms where they can talk to the nurses. And I know that when we've had patients here, they're really good at like updating us at Patient Concierge Services, and I think the partnership between us and you guys works really well. Have you noticed anything different from the patients that come to you from PCS?
So actually, I'm very thankful for the PCS because the PCS put their position in the neutral position, right? But they help the patient to be informed about all the procedure, especially from the pre-operative and also the intraoperative, and also especially the aftercare.
Yes.
Because the hardest part is actually the aftercare. So the PCS role there is actually to help the surgeon to accompany the patient, so they understand relaxed and less nervous. So I'm very thankful.
And we're thankful for the partnership as well.
Yes.
And actually, our second birthday this year.
Congratulations!
Thank you. I think it's like October. I'd have to double check the date, but we're learning all the time. About everybody's journey, and then I think the aftercare is very, very important. And obviously, from a doctor's or a surgeon's perspective, you see the aftercare as making sure they don't get an infection and making sure that their well-being is cared for. But we also really notice that actually before surgery is also really important, because this is when they really struggle sometimes with nervousness, and if it's their first time coming to Bali, like they're like, am I going to a developing country? Is it safe? And actually the support that we offer in the lead up to surgery, we've had feedback that it's really, really valuable, you know, in terms of like keeping them calm, and their nervous system is a lot more calm. So yeah, we really love looking after patients and bringing them to NgoerahSun. So thank you.
And I feel very relieved if the patient is accompanied by a concierge services, because it's like reducing half of my job. So there is a Karen. If there's something happen, then Karen will contact me directly in a very professional way, and a good and better communication, because you already in this field like for quite long, so you understand what happened and what to tell me if there's something that
we can get the history or whatever. Beautiful. Thank you. So we're coming towards the end of this interview, and you have been absolutely amazing and explaining everything in such thorough detail. I'd just love to end with one more question. So for anybody who's watching who is on Patient Concierge Services social media channels, or also in the Facebook community called Facelift in Bali, founded by Pamela Lovegrove, if there's anybody watching who's feeling a little bit nervous and they've been dancing with this decision for maybe years, and they don't really have the courage, or they need a little bit of information and like to make that decision to come to Bali for plastic surgery, could you offer any words of wisdom or advice to them?
Okay, I think it's in my surgeon perspective to use that nervousness is I take time to explain to the patient, so they can expect and not like be surprised about the pre-operative, about the surgical procedure, and especially the aftercare. So, Dr. Putri already explained me about this. So it's okay. So it's going to be hurt a little bit. So this hurt a little. This is normal. So their nervous system will calming down. And also that's on my surgeon perspective. And also in our center, I can say that our style is, so safety is above all. We are not do upselling. We're not doing like over treatment, but we really respect the safety, and we have all the equipment and the team here to make that happen about the safety one. So I think it can make the patient less nervous, because they are scared about especially the one who has so many comorbid, right? Many medical conditions. So they feel like nervous about how they will be taken care of. But I can say our safety here, we really care about safety. And also outside of the surgeon and facility perception, I think talking with the same peer groups is very important. Like the community, the one that already been through the same procedure and how they manage to do the aftercare and also to get past of the healing process. I think it's very important. And also I think the role of concierge services like you is very important and helps a lot. Because you've been accompanying many people, so you can reassure them in a very neutral way, not like pushing them to do the surgery. It's up to their decision, back to their decision, but you give the information. You just work together to make them like calmer.
Thank you so much. So the key message is just to keep chatting, you know, they can have a video consultation with you. You can help prepare them with what's going to happen. We can also do the same. So it's like reducing the volume of uncertainty and making them really clear. Because I think sometimes our mind plays tricks on us. We dream up these stories when actually we can just ask the question and get clarity. So ask the questions, have a consultation, get all the information, and then we can also help as well with anything that you need in terms of accommodation, the care and concierge, and the nurses that will visit you after surgery as well. We'll fully take care of you. So you can drop us a message on our WhatsApp number and we can chat further there. Thank you so much.
Thank you very much.
Amazing. Thank you very much.